hi everyone. Thank you again for joining us for another Good Breeder webinar. I'm Nicole, Good Dogs Community Lead, and today we're going to be presenting on managing a stellar stud dog weaning through age 4 with our guest, Dr. Cheryl Lopate, and I wanted to share just a bit of an overview of what we're going to focus on today. Optimal performance in a stud dog obviously requires proper nutrition, exercise, parasite control, and vaccinations. A stud dog should pass the breed's health clearances and genetic testing, as well as breeding soundness examination. Effectively managing a stud dog requires an understanding of semen evaluation and methods to maximize and best preserve future genetic potential. So in today's discussion, part 1 of a 2-part event, we're going to focus on weaning through age 4, and we'll discuss contractual agreements to protect a stud's reputation and why it's important to have a reproductive veterinarian, among many other things. So very excited for today's topic, and I know our community is as well. And as always, we're so excited to partner with Purina to bring you this webinar. This is something that I think is going to be really interesting to members of our breeder community and really important to them. So as always, please continue using the comments, using breederteam@gooddog.com to email us to just let us know what you want to see more of in the future, what type of content you like that we brought you so far, what you have burning questions about that we haven't touched on yet, because it's so helpful for us as we just continue planning these webinars and all of this content. So please continue telling us what you want to hear. And as always, during the Q&A part of this presentation, which will be at the end, we're going to prioritize those previously submitted questions from our community. So thank you to all of the people that submitted those. And then, of course, if you want to ask questions throughout the presentation, we'll do our best to answer those if we can. So you can use the chat and we will make sure that we answer those. So feel free to drop any questions there. And before I talk a little bit more about Dr. Lopate, who is joining us today for the presentation, I want to share a bit more about Good Dog in case anyone's joining us and is totally unfamiliar with who we are and what we are. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders like yourselves, educating the public, and promoting canine health and responsible dog ownership through events just like this. We help good breeders level up their breeding programs by providing them with tools like our secure payment system to protect them from scams and software to post available litters and start connecting with amazing Good Dog buyers from all across the country to find great homes for your puppies. So if you're not yet a member of our community, we would absolutely love to have you join us, and you can apply to join at gooddog.com/join, which we'll drop in the chat so everyone has that. And now I want to just quickly share a little bit more about Dr. Lopate and her amazing background in canine health before I pass things over to her. Dr. Lopate completed a master's degree in reproductive physiology and her veterinary degree at The Ohio State University. After a residency in comparative theriogenology, that word always trips me up, at Purdue University, Dr. Lopate became a diplomat of the American College of Theriogenologists. She continued at Purdue as a clinical instructor for 2.5 years. During this time, she spent 6 months on sabbatical in Queensland, Australia, working at an equine and small animal referral practice, which sounds like it was very cool. Dr. Lopate opened her Reproductive Revolutions referral practice in Portland, Oregon in 2003 and merged the practice with a general companion animal practice in 2011. She has a special interest in ultrasonography during pregnancy, high-risk pregnancy, and male infertility. Dr. Lopate lives on a hobby farm with a Pembroke Welsh Corgi and an Australian Shepherd, a small flock of sheep for the dogs to herd, of course, a Cleveland Bay gelding, 2 donkeys, and a bark cat. You sound like you have an amazing setup where you are. I'm very jealous, and a very diverse crew of animal critters. But that's it for me. I'm going to pass things over to you now, Dr. Lopate, to get the presentation started.
All right. Thank you, Nicole. And I'd like to thank the Good Dog team and Barb for inviting me to speak on this topic. We have a series of 4 lectures, 2 now on the stud dog and then 2 in the fall on the brood bitch. Today's lecture, we're going to concentrate on weaning through 4 years of age and getting ourselves set up for setting us up for having a stud dog career. So we're going to start with that initial exam that we do usually around 7 to 8 weeks should be done at your with your veterinarian. And the things that we want to check in that exam are the puppy's bites, make sure that they're correct for the breed. We want to sculpt the heart and listen for any murmurs or arrhythmias. Anything that's more than an innocent, quiet murmur, 1 to 2, should be referred over to a cardiologist to determine whether that is a pathologic murmur or not. We often hear murmurs in young dogs because they have very small hearts and very high heart rates, and that can create turbulent flow in the heart. And all that a murmur is turbulent flow of blood. And so a lot of these murmurs are innocent, and they're going to disappear as the puppies grow and their hearts get bigger and their heart rates slow down. So hearing a murmur in a young puppy is not necessarily a bad thing, but loud murmurs in puppies should be investigated so that the new pet owner, where it's going to be going, understands whether they need to be following up on this or whether they have a problem that they're going to have to address. We want to check puppies for the location of both testicles, whether they have any evidence of an inguinal or scrotal hernia. And those are really the 2 hernias that I think are going to affect whether we should have this dog in a breeding program or not. Umbilical hernias are considered a blemish and should not preclude any dog from being in a breeding program, but both inguinal and scrotal hernias are hereditary, and those dogs should not be included in breeding programs. We want to check all of our dogs for patellar luxation, regardless of their size. We often find in young puppies that they have some patellar laxity, but the patella should quickly pop back onto the groove. And if they have significant patellar luxation, then that's something that we want to encourage. Strengthening the hind end with exercise and obstacles so that we tighten up those ligaments. And that's something that should be followed as they grow to make sure that that resolves with development. And if not, especially in our smaller breeds, then these dogs may not be ones that we want to put into our breeding population. We want to, of course, look for any obvious conformational concerns, any ligament laxity, which is often a sign of too rapid growth in young puppies. And we want to assess that puppy's body condition. We don't want to have our puppies growing too rapidly, especially our large and giant breeds. And we'll talk about nutrition later. So this is something that we want to kind of assess at the get-go during this first exam. Do we think that these puppies are getting too much nutrition? Is their diet too high in protein and causing too rapid growth? Puppies that are cryptorchid, so any puppy that is 8 weeks of age and does not have 2 scrotal testicles is considered a cryptorchid puppy. Normally, the testicles are in the scrotum by 2 weeks of age. It's just that they're very small at that time and often difficult to palpate. So we give them until 8 weeks before we're going to give them whether we're going to call them a cryptorchid or not. If those testicles descend between 8 weeks and puberty, those puppies are really still considered cryptorchids. They just have delayed descent. But that delayed descent is still associated with the cryptorchid gene. And we have, there are papers that document that the cryptorchid gene is associated with genes for hip dysplasia and patellar luxation. So these puppies that are cryptorchids, we don't really want to include them in our breeding population because we don't want to bring hip dysplasia or patellar luxation into our breeding pool of animals. So this little picture over here shows a dog that has bilateral inguinal hernias. So these kind of little mounds of tissue here. those little mounds of tissue there is herniated fat. And this puppy also was a cryptorchid puppy, so has one testicle that's smaller than the other. It did eventually descend into the scrotum, but certainly this is not a dog that we want in our breeding program. It's got two congenital defects that it can pass along to other offspring. So follow-up exams for our dogs as they age. These are things that we want to be doing basically from the time that they're young puppies until they're old dogs, as long as they're intact. We should be doing monthly assessments for changes in testicular size or tone, or epididymal changes, any thickening or enlargements. And that's something that every breeder should just get used to doing to their intact dogs. They should all be checked at least once a month, and a veterinarian consulted if you notice any changes there. Changes in scrotal thickness or any abnormalities in the scrotal skin, so dermatitis or abrasions, wounds, we want to address those things quickly because they can affect the thermal regulation of the scrotum and the sperm production. And then any evidence of either bloody drippings from the prepuce or blood in the urine are reasons to assess prostate health. And that's really regardless of age. We see puppies that are young dogs as young as 10 to 12 months sometimes that have benign prostatic hyperplasia already, and will have bloody discharge. So they don't have to be, 4 or 5 years old to have prostatic disease. Anytime that we see blood in dripping from the prepuce or in the urine, we want to get to a veterinarian and assess where that's coming from. Any evidence of straining to defecate or flattening of the dog's stools would be a reason for a veterinary exam. Changes in libido or their ability to breed a bitch would also be reasons for exams. And then any signs of lameness or back pain, because that may be associated either with prostate disease or with some type of injury that may affect their breeding ability. Okay, so we're gonna talk about vaccination, and the first thing that we need to talk about with vaccination is when do we start? So we often will start vaccines at 7 to 8 weeks, and that's just a matter of our our normal routine. We expect most puppies are going to start to have enough decay of their colostral antibodies, excuse me, by about 8 weeks of age. And so that's when we want to do their first vaccinations. Unless you're in a very specific situation where you have a high parvo risk, there's probably no vaccinations that should be done before 7 weeks of age. Colostral antibody is going to block any response that puppy has to vaccines. And so we're, number one, wasting vaccine, but two, also potentially setting those puppies up for reactions to the vaccines when they're not going to get any benefit from them. So a better way to determine when to do the first vaccination is via titering of either the bitch or the puppies. And these are called nomographs. They're done by the KVIDS Titer Testing Lab, which is at the University of Wisconsin by Dr. Lori Larson. And basically what is done is that the bitch is titered either from the point where she's in heat until mid-pregnancy. We often do our nomographs at the time of that early pregnancy ultrasound, so about 3.5 weeks after ovulation, if she's pregnant. And then her titer is determined. And then, as you can see on the bottom of this nomograph form, they will put the bitch's titers in, and then they can calculate how quickly that titer is going to decay over time. And based on that decay, they're going to say, okay, when should these puppies be vaccinated based on their decay? So, in this group of puppies, they had recommended distemper vaccination starting around 9 weeks, because that's when we're really starting to see the decay of the maternal antibodies start. Parvo vaccination doesn't really need to start until 12 weeks of age. And granted, we often do these vaccines in combination, but the Dr. Larson's group will, say, okay, if you can give vaccines at 9 weeks, but for certain you need to give them the first one at 12 weeks and then a second one at 15 weeks. And then they always recommend for every puppy titering those puppies after vaccination about 4 to 6 weeks after the last vaccination, to make sure that they had an appropriate response. And that's not something that is necessarily commonly done, but it is recommended to make sure that they have responded appropriately to vaccination. And I think a lot of times if you're starting early on vaccines, they're not going to respond to that first vaccine. And so we want to make sure that we're getting an adequate number of vaccines done during the period of time when they're going to get an appropriate response. So if you don't get a nomograph on the bitch, you can do them on the puppies as well. We usually do them around 3 to 4 weeks of age, which is we're gonna kind of be in this range here. So we're kind of at kind of moderate maternal antibody levels. And then they'll do the same type of graphing for those puppies. When do we expect decay to start? And then when to set up the first vaccination in the series. You only need to do one puppy in a litter, assuming that everybody nursed appropriately and the bitch had good colostrum. And so, like, if you have a puppy in a litter that maybe was a small, weak puppy that didn't nurse well and you were supplementing milk replacer early on, that's not the puppy that you want to choose for the titer for the entire litter. You want to choose a puppy that nursed strongly and well during the first 12 hours. And so either way works, but this is a great way to determine when to do your first vaccination. As far as which vaccines to give, we're gonna give all puppies our core vaccines: distemper, hepatitis, adenovirus, parainfluenza, and then lepto. And then the rest of the vaccines are going to be based on lifestyle, risk, and location, which would include our respiratory vaccines, Bordetella, influenza, and then vaccines like Lyme for our tick-borne diseases if you're in high-risk areas. We want to be sure that we complete our vaccination series in a timely manner. And for anybody who is even remotely contemplating, we might be freezing semen or shipping semen internationally on this dog when he's later. Certainly vaccination for lepto is always a good idea, because a lot of the foreign countries require lepto titers or proof of vaccination. And if they're not current on their vaccines, then an elevated titer is considered potentially an exposure, and that semen is not going to ship. So routinely vaccinating for lepto, starting when they're young dogs and doing it annually, to make sure that your titers are always current, makes it so you won't have any issues with lepto titers when you need to ship semen. Rabies vaccinations are done between usually 4 and 6 months, and then all the vaccines are going to be boosted at a year. And after that, then repeat vaccinations may be done for some breeders based on titers, and other breeders are going to just use manufacturers' recommendations for either yearly or every 3 years, depending on the vaccine and the company. We want to try to avoid vaccinations prior to upcoming breedings, semen collections, or freezes, because sometimes we'll have a low-grade fever after vaccination, and we can see effects of that in the semen for 4 to 6 weeks after the fever has occurred. For deworming, the type and amount of deworming is going to depend on environment and exposure, but all puppies should be dewormed regardless of whether the dam has been exposed or the deworming status of the dam, because there is transplacental and mammary transmission of larvae of both hookworms and roundworms to all puppies. regardless. So all puppies should be dewormed, usually starting around 3 to 4 weeks of age and repeating again in 2 weeks with a moderate dewormer, something like Pyrantel, that's not going to get 100% kill on any adult parasites. And we like to have that more moderate kill because if they do have a heavy load of parasites, it's less likely to get them sick or have an intestinal complication. Overall, we think that prevention is better than treatment. So monthly heartworm preventative is going to, most of them have an adulticide dewormer in them. So you're basically removing the adult population of parasites every single month from the dog's gut, and that will reduce problems that they're going to have with infestations of large numbers of adults or larvae in the gut wall. And so we do recommend that routine deworming. Heartworm and flea medications are going to, again, depend on location and environment, but generally speaking, we think that pretty much all of the avermectins and milbemycin is safe for all breeding animals. Furlaner, which is Bravecto, I think is very safe for male dogs. And when we have our female discussion in the fall, we'll talk about using Bravecto for females. There's a little bit of concern there, but it does have a label for reproduction, but it's somewhat questionable for the females. So as far as feeding is concerned, we want to be sure that we're feeding a food that's appropriate for the puppy's life stage. So dogs that are in growth in the first 1 to 2 years should be getting a puppy or a performance food. And then once they become adult dogs, then they should be transitioned over to an adult dog food or a performance food if they're high activity dogs or high metabolic rate dogs. Not just because the dog food has the label of all life stages does not necessarily mean that it is appropriate for growth. It means that it meets the minimum AAFCO standards for growth, but not necessarily is the best food. So you may want to talk with your veterinarian if you're using an all life stage diet to make sure that it's appropriate for your puppy's growth. And then we want to feed a food that is going to be appropriate for that puppy's adult size. So if you have a small or a toy breed, medium breed, you're going to feed any, routine adult or puppy food, and then adult dog food. For our large breed puppies, we want to feed a large breed puppy food. And for our giant breed puppies, we want to feed a giant breed puppy food. Some of our large and giant breed breeders will tell clients to feed an adult dog food to try to slow their growth. But these adult dog foods are not appropriate for puppies and for the development of bone because the micronutrients are different in puppy foods compared to adult dog foods. So it's really inappropriate to feed an adult dog food to a large breed puppy just to limit protein. So choose a large or giant breed formula for your large or giant breed puppies. And then the amount that's going to be fed is going to be based on that dog's metabolic rate, their activity, and how they're growing. And so we use the bag label to get us started, but then we're going to, increase food as puppies go through growth spurts and are doing more things. If they're getting too lean, we're going to feed more. If they're starting to get too fat, then we're going to feed less. We want to try to maintain a lean body condition all the way through puberty, so at least through 12 to 14 months of age. And this is because they're replacing their brown fat, which is what they have when they're fetuses and neonates, with white fat. And if we don't overload the abdomen with white fat, then these dogs are much easier to maintain normal body condition as they get older. And for the rest of their lives. So keeping them lean as puppies is always the goal. And then of course, we always want to make sure that any dog food that we're feeding meets AAFCO standards and has veterinary nutritionists that are balancing the ration. We want to be sure to avoid obesity in our dogs, especially our young dogs, because having a fat puppy with fat at the neck of the scrotum may affect that dog's fertility for the rest of its life. And then as they get older, dogs that are over-conditioned are going to have more trouble being able to breed naturally. You always want to avoid fad diets. Many of the boutique brands will market to what the humans may want to be feeding their pets and not necessarily what's best for feeding your pets. So try to avoid fad diets and stick with the science. I think that all puppies should be, no puppy should be fed a raw diet until they're at least 12 months of age when they have normal gut immunity, because they're at increased risk for getting infections when they're young. And that gut immune system hasn't fully formed yet. Supplements that we can think about for our stud dogs, and we can start these supplements when they're very young dogs. These all just kind of promote good environment in the scrotum. And these are, none of these have ever had studies done in dogs done on them, but they have been studied in humans and horses and cattle, sheep, pigs, and have been shown to affect improvements in motility and morphology. So these are things that we can consider: feeding omega-3 fatty acids that are mercury-free and xylitol-free, glucosamine supplements, a DHA supplement, which is Purina Muscle. And you want to be sure that your Purina Muscle supplement is arsenic-free, vitamin E, zinc, and L-carnitine. So these are all supplements that we use when we're having fertility issues, but will also promote a good environment in the scrotum. Sorry. Supplements to avoid. We want to avoid estrogenic foods, and there's lots of them, both fruits and vegetables. We want to avoid non-esterified oils like flaxseed. That's the most common one that's fed. We want to avoid any supplements that contain pituitary extracts. Like the standard process supplements are basically just ground up pituitary gland from cattle. And those can affect the hormonal environment in the testicle. So we want to avoid those. Always try to be suspicious of any supplement that is touted to be good for reproductive health, because many of them are actually the exact opposite of that, not good for reproductive health. And I would recommend checking with a reproductive specialist prior to using any type of reproductive supplement. And I think it's best to check with an actual board certified theriogenologist in this, because a lot of general practitioners simply haven't been trained in all the nuances of supplements. And so often will not realize that something may not be good for a dog in these supplements. We're always cautious about herbal supplements that have multiple ingredients, because while each ingredient might be safe by itself, sometimes when you combine them, they become less safe. And then just remembering that there is no FDA monitoring or guidance on any type of nutraceutical or supplement. So people can make whatever supplement they want. They can say whatever they want about it, and they don't have to back it up with anything. So just be cautious about the supplements that you use. We'll talk about health clearances next. Health clearances are determined based on each breed's genetics, the health conditions that they typically get, and what their use is. And there are guidelines for all of the AKC breeds on the AKC Chick website using the Browse by Breed link. And then most of the breed websites will also have the health conditions that are common to the breed. And those are the things that should be tested for. So there are a couple of the health clearances that can be done prior to a year. Their eyes can be done, and their hearts they can have their congenital heart exams before they're a year of age. But most of the rest of them, other than genetic testing, that require them to be at least a year of age or older. And some things like hips you can do prelims before they're a year, but you can't get your final certification until they're 2. So you just need to read the guidelines for each of the health clearances and when they should be done. Eyes are typically done annually in most breeds because there's a lot of eye diseases that won't become evident until the dogs start to age. And so some breeds will give guidelines, annually until they're 5 or annually until they're 8, and then they consider them to be free from needing more testing. Genetic testing can be done at any age from birth until the dogs die. Their genetics never change. And most of these, right now, most people are doing either Embark or Wisdom panels, which are these great SNP panels that have 180 to 200 genetic tests. And I really think that they're a good idea rather than just doing 3 or 4 genetic tests that are common in your breed, because every once in a while we'll get a dog that is a carrier or affected by a genetic disease that is not common in the breed. So you wouldn't have tested for it routinely, but it's something that is a significant health concern. And then you want to be sure that if you're going to be breeding that animal, that you're breeding to something that's clear for that disease. Your health clearances should all be completed prior to a male being included in a breeding program. So regardless of the breed that you are, all health clearances should be done before you start using that dog as a breeding animal. So genetic pairing, how do we decide who to breed who to? The goal of selective breeding programs is to increase the genetic merit of the breed by improving health, longevity, and functionality of the individuals that we're producing. And so that should be our goal, all of our goals for breeding. Traditional breeding programs have used inbreeding coefficients as the main way to help with selections, along with phenotypic type exams. But more modern programs have started to use estimated breeding values, and estimated breeding values have been used in our production animals for hundreds of years to try to help remove bad genetic traits and improve good genetic traits. Estimated breeding values combine the animal's phenotype with statistics and genetics to select young individuals who are going to remain in the breeding program to try to help improve traits. And the estimated breeding values, and you create an estimated breeding value for each trait that you want to include in your breeding program, and then you combine these to develop a selection index depending on the importance of that trait to the breeding program. So the most important traits are going to be on at the top of the index, and the less important traits at the bottom. And it's always important to realize that most traits that we're trying to breed in or out are complex and multifaceted. So you have to, you need to include as many different things around a trait that you can. So what the animal looks like, what the genetic test says for that trait, and then what are the chances that this dog is going to produce it? Is he a carrier or is he affected? These estimated breeding values do require a large number of individuals, and it requires dedication to trying to affect these changes, because sometimes a dog that we may have really planned on using and wanted to use is not going to be the best individual to use, and we have to be willing to remove that dog from the breeding program if he's not going to be a good fit. So the Working Dog Project is a really great example of the use of estimated breeding values. And this is kind of their little setup for how they have gone through their process. So they first defined what goals they want to improve. Then they collect the phenotypic data, looking at the patients, getting lab values, doing health clearances, those types of things. Then they identify which of these, which things are heritable. So which things can we change by breeding? Calculate your estimated breeding value. And then we're going to select the individuals that are good candidates to be used in the breeding program, and then choose which male to breed with which female. So for our young dogs, we always want to be sure that we're promoting good breeding behaviors. So we don't want to breed young dogs until they have gone through puberty, because breeding dogs that are pre-pubertal can result in more aggressive posturing towards their housemates, their kennel mates, or to outside dogs, or even to people as they get older. So best to let them get all the way through puberty before we try to collect them. And in our practice, we generally use 1 year as that minimum age, and that will have pretty much all the dogs through puberty. So if we wait until they're a year to collect them, then we know that we're not going to affect this negative, aggressive behavioral change that some of them can have. We want to always remember that you should never reprimand a dog for showing interest in females, regardless of their age. If we want to use them as a breeding male, then anytime that they are showing interest in females, we need to either positively reward them for that, or we need to redirect their behavior so that they're not doing it, but we're not punishing them for it. If we punish them for showing interest in females when they're young, or when they're at the dog show, or they're out on a walk, then when we want them to pay attention and be interested in females, they're not going to do that because they're worried that they're going to be reprimanded. So the best ways to do this are by separating the intact bitches from the intact males when they're in heat. If you have a bitch in the house that is in heat, to try to reduce the pheromones that she's producing, you can feed chlorophyll pills, which you can pick up at any health food store, and that reduces the amount of pheromone they produce. We want to be sure to prevent accidental breedings. And so the best way to do this is to separate males from females from the time that they're in heat until 1 week after the bitch goes into diestrus. So she exits her fertile period, and a week after that, and then that's a safe time to reintroduce them. If we don't know when diestrus day 1 is, then the next best ways to determine that are waiting until all of the vulvar swelling has gone away, or a week after all the vulvar swelling has gone away, or 2 weeks after the last signs of blood are noted. But these are not fail-safe ways to prevent accidental breedings, because some bitches don't bleed very much or at all. And so then we really don't know when they leave the fertile period. And some bitches, their vulvar swelling never goes away completely. So better to determine when diestrus day 1. And if you're not doing cytologies, if you don't know how to do a cytology yourself, you can just run them into your vet, a week after they look like they've gone out of heat, and have them do a quick vaginal cytology. It takes 10 minutes. And we know that they are truly out, and then you can wait a week more and put them together. Panties are not contraceptives. A dog can breed a bitch that has panties on in a split second. So that is absolutely no way to prevent a breeding is by putting a pair of panties on your bitch. Gates and fences are not barriers when the incentive is high. Dogs can climb a 12-foot fence straight up and get into a yard where there is a bitch in season. They can dig a hole, a 3-foot hole under a fence, and get into that area. So they need to be fully contained and separated. We don't want to wait until the male starts to show interest in order to separate them, because often within a minute of the male showing interest in the female, there's a tie. So just separate them from the time that she comes into heat until she's well and truly a week out of heat. If you're going to house intact males and females at the same location, then be responsible to keep them separated when the bitches are in heat. As far as stud dog owner responsibilities, honesty is always the best policy. If your dog has a fertility issue or he's missed a couple of bitches, be sure to tell people that up front when they come to you about breeding to your male. If you're honest about what your dog can do, then people can go to their veterinarian. They can make the best management plan. They can plan for the best breeding and have the greatest chance of success. If you hide information because you don't want people to talk badly about you, then when that bitch is not pregnant and they find out that you withheld information, that's a lot. It is a lot worse on your reputation that you were withholding information. So just be honest and upfront from the get-go. If you're charging someone a stud fee, you need to be able to stand behind the product that you're selling. So if you're charging someone, $1,000 to do a shipped semen breeding, then you should be providing semen that is going to get a bitch pregnant, or if it's lesser quality semen, that the bitch owner and their veterinarian understand exactly what they're getting and it's not a surprise. If the bitch owner requests a current semen evaluation when the bitch comes into heat, then you should provide that for them. And I think it's a good idea if you have a breeding and your dog hasn't been used, recently, and you have a, litter on the ground, or there's a bitch that's pregnant from your dog. Doing a semen evaluation when the bitch comes into heat is just a little bit of added protection for you, because if you know that we did this semen evaluation the day the bitch came into heat and his semen looked great, if she's not pregnant and we bred her at the right time, then it's more likely going to be on the bitch than it is going to be on the dog. So it's just providing protection for you and your stud dog to get that semen evaluation done. We'll talk a little bit more about brucellosis later, but if you have a breeding coming up, you want to do a brucellosis test within 2 months of when that breeding is going to happen. And our screening tests are only good for 2 months. So you may need to repeat that. If you did one, 4 or 6 months ago, you may need to repeat it for an upcoming breeding. You want to always be sure to maintain good breeding records. You want to keep track of the types and the numbers of breedings for each bitch. Whether the bitch got pregnant, how many puppies did she have, how many were at the ultrasound, how many were there at the x-ray, or did she deliver? So that what the success rate that you've been having with your dog. You want to get information about the age and the reproductive history of any bitch that your dog is being bred to. So how many litters has she had in the past? How many puppies did she have? Did they all survive? All that information is good for your records as well. Anytime you have semen collected, there should be some type of evaluation done, and that may be just a motility and a gross evaluation for numbers, or maybe a complete evaluation if the dog hasn't been collected for a while, with a motility, a morphology, and a count. And I know that there was recently just a good dog webinar on semen evaluation, so I'm not getting into much detail on that. But a full semen evaluation, anytime the dog hasn't been collected in, more than a month or two, is a good idea and good insurance policy. If you're shipping semen for the first time, we recommend having a longevity exam done on the dog to make sure that he's going to chill adequately and that sperm is going to live at least out to 72 hours after collection, so that you know that the product that you're going to be shipping is going to be viable for the bitch. And then when we talk about planning our breedings, we want to do ovulation timing to ensure that bitches are bred during their fertile period and not just when they're receptive. Receptive behavior does not necessarily equate to the fertile period of the bitch. Receptive behavior is a result of the change in estrogen and progesterone. So estrogen drops and progesterone rises just prior to ovulation. And that receptive behavior and male interest is driven by that change. So for a bitch that either progresses quickly through her cycle or slowly through her cycle, those bitches are going to stand and the males are going to be interested outside that bitch's fertile window. So breeders tell us all the time that they have an experienced stud dog and they know exactly when that bitch ovulates. So they don't need to do ovulation timing. But there is no dog, I don't care how many bitches that he's bred, that has any idea when the bitch's fertile period is. He only knows when the estrogen to progesterone ratio changes. And that may or may not be close to or around the bitch's fertile period. And in fact, about 40% of the bitch's cycles, the receptive behavior is going to be at least somewhat outside of her fertile window. This can be overcome a lot of the times by the fact that fresh semen can live for 10 or more days in the bitch's tract. So the bitch could be bred 10 days before she ovulates, and sperm will still be available at the sperm reservoir to fertilize those eggs when they become mature. So people think that their dog knew when to breed her because she got pregnant, but he actually bred her a week or 10 days early. And not anywhere close to her fertile window. Ovulation timing will also help to protect the stud's reputation if, number one, you know that the semen quality is good, and two, if you know that you bred her during her fertile period and she's not pregnant, that we know that then the bitch was bred at the right time with good quality semen and not pregnant. Again, we need to be looking to the bitch for the reason for her failure to conceive rather than blaming the stud dog. When we're talking about managing the breeding schedule, we want to try to not breed more than every 48 hours. And there's two reasons for this. One is it allows the dog to replenish the sperm reserves in the epididymis, and then increase the number of sperm that will be ejaculated for the second breeding. And two, giving the bitch a break of 48 hours allows her uterus time to recover from the post-mating induced endometritis that develops after every single breeding. So sperm is inflammatory because it's has foreign antigens on it. It's not supposed to be in the bitch. And so the bitch has an inflammatory reaction to the sperm. And this happens in 100% of breedings. Some bitches have a more profound inflammatory response and are less capable of subduing that inflammatory response than others. And so giving them 48 hours to recover from a breeding is going to be better for the health of the bitch's uterus. If you have a dog that has low sperm numbers or poor semen quality, then oftentimes we want to wait until the end of the fertile period to do a very well-timed breeding with the maximal number of sperm that we can collect out of a dog. So ovulation timing will help us with that. When we talk about semen collection, I think that all dogs should be trained to collect, regardless of whether we ever intend to do an artificial breeding with them or not, because you never know when the dog is going to be presented with a bitch that is not going to be receptive to him, and so you can't get a breeding. Or she might have a vulvar stricture or a vaginal stricture, a hymenal remnant, and so you can't accomplish a breeding, and then you're going to have to collect him. And the time to train the dog to collect is, generally speaking, not at the time that you need to do the AI. So dogs that are timid, or breeds that are more timid, we recommend starting that training early and continuing until they're comfortable. It may be a single session for some dogs, and it may be multiple sessions for some dogs. And we just keep going until we can collect them easily. We want to use positive reinforcement and positive training for all of our collection sessions. And it's always best to use a teaser bitch if possible. Sometimes we won't have a teaser available, but we can use swabs or pads from a bitch that was in heat that we've kept in the freezer for scent with a bitch in front of them so that they think that that smell is coming from her. But best to actually use a bitch that's in season. And I always think that it's good to train dogs to collect with different breeds than their own, because sometimes you don't have a bitch in season of your own, and you need to do a chilled shipment, or you're doing a freeze collection, and you need some teaser in front of him. But it's not going to be his breed, and some dogs are particularly bad about being breed snobs and not wanting to collect with anything that doesn't look like them. So training them when they're young dogs that it's the scent that they're after, not necessarily what that other bitch looks like, is always helpful. We do have a couple of medications that we can use if we need to get a collection done today and we have a dog that has never been collected before and is nervous. Gonadotropins can raise testosterone levels, and luteolase or prostaglandin can be used to help the muscular contractions through the epididymis and the vas deferens to get sperm to be released. For our semen evaluations, we want to do these before the first evaluation between about 1 and 2 years of age. And if semen quality is suboptimal, then we want to get these dogs on fertility supplements, look at their diet, see what other supplements they're on, make sure they're not getting any estrogenic foods that may be affecting them, or drinking water that's tainted with something. If the semen quality is normal, we recommend freezing semen at least once before 2 to 3 years of age, because you never know when something's going to happen to your dog. And if you lose the ability to breed him because you didn't have a semen stored, when he's 6 or 7, and then he has an accident, then all is lost. So freezing them when they're young and their fertility is best is always ideal. We recommend that you get a full semen evaluation done by someone who's trained to perform it. If you get a semen evaluation back from somebody and there are no head or mid-piece defects noted at all on that exam, then it's unlikely that that's an accurate semen evaluation, because most dogs, probably 99% of dogs, are going to have at least one head or mid-piece defect on a collection. And granted, every once in a while we'll have a dog that doesn't, but most dogs are not more than 75 to 85% normal sperm, and that's still considered a normal ejaculate. Anything over 70% normal. And the reason that there are 1 billion sperm and 10 eggs is because there's usually a lot of abnormal sperm in an ejaculate, and there's nothing wrong with those types of numbers. So if you're constantly getting, semen evaluations that are 95% normal and they're all tail defects, then we're probably not looking carefully enough at the sperm to pick up the head and mid-piece defects. And so, sperm can be motile and be abnormal, like these sperm that have knobbed acrosomes. There's another knobbed acrosome, or abnormal head shapes, reflex mid-pieces. These sperm can be motile, but they're swimming backwards and they're never going to fertilize an egg. So just looking at motility is not a good way to evaluate whether this dog is going to be fertile or not. So a complete semen eval by someone trained to perform it is ideal. And then if you're going to ship semen, you should also do a longevity exam to make sure that he's going to chill well. Total sperm numbers are are dictated by the size of the testicle. So bigger testicles produce more sperm. And thus toy breeds have lower sperm numbers than our giant breeds. And the amount of sperm that is stored in the epididymis that is ready to be ejaculated is going to hit kind of its low after 5 to 7 days of daily collection. So if you're breeding multiple bitches at the same time, you may get to a critical low number of sperm after 5 to 7 days of collections or breedings. If we're shipping semen, the difference between a veterinarian collecting semen and a breeder collecting semen is typically going to be the type of semen evaluation that's going to be done. A lot of breeders will have microscopes so they can do a motility, but they're not doing a count or a morphology. And most breeders, although some do, are not going to be able to centrifuge semen and remove the prostatic fluid, and that is going to reduce the quality of the semen that's received. We always want to be sure that semen is labeled appropriately with the dog's name, his breed, and the date. Registration number if you've got it, but we don't always have that. And then there should be paperwork in that box that documents who the stud dog owner is and which stud it is, and a semen evaluation, preferably a semen evaluation report. And then just making sure that if it's a breeder that's collecting or you're going to a veterinarian, that they are knowledgeable in how to package semen. We don't want to receive semen like this where there's a bunch of liquid in this box that may contaminate our samples that is getting around where the sperm is sitting. Brucellosis testing is something that should be done on all dogs, regardless of whether they've bred anything before or not, because it's passed by aerosol as well as venereal contact. We typically test with screening tests, and these are good for 2 months. So if your dog gets exposed to brucellosis the day after he has a negative screening test, it will take him 2 months before he's going to have a positive test, unless you're doing blood cultures to pick up those acute infections. So brucellosis tests need to be done every 2 months to kind of keep on top of the dog's current brucellosis status. And there are a lot of false positives with our screening tests. They're designed to pick up every positive case. And so there is cross reaction to some bacteria that's similar to brucellosis on these tests. And so we'll get some false positives, and those will need to be differentiated on confirmatory testing. The screening tests are done because they're quick and we get fast turnaround on them. But if they're positive, then you have to do confirmatory testing. You should never assume that a brucellosis on a screening test is positive. Dogs can be infected and shedding bacteria without any obvious symptoms. They usually have palpable abnormalities once the bacteria has taken hold in the epididymis. They'll have lesions, but if you're not palpating the testicles, you wouldn't know that anything else was happening with the dog. So they can be infected and shedding bacteria into the environment without obvious symptoms other than enlargement of the epididymis. So just kind of getting to the end here, ways that we're going to maximize fertility in our stud dogs is using ovulation timing, knowing that receptive behavior is going to incorrectly document ovulation about 40% of the time, and fresh semen can kind of override this poor breeding management because of the longevity of the sperm in the bitch's tract. But it does lead to an incorrect due date for the bitch owner if you don't do ovulation timing, because you're basing that on a breeding date rather than when she ovulated. We should never force breedings. If a bitch is not receptive, we should not force her to stand to be bred. We should switch to AI if she's not receptive. And we want to utilize AI for young males that might have lower counts. So for, collecting dogs right around the time of puberty, their sperm counts may not be at maximum yet. So using intrauterine insemination is going to increase their fertility. And then inexperienced breeders that can't accomplish natural breedings, utilizing AI will help with those dogs as well. If you have multiple bitches to breed at the same time, you really need to do ovulation timing so that we know when each bitch's fertile window is, and we can breed the dog to each bitch at the best time during her fertile period. If we're collecting a dog that has adequate sperm numbers and 2 bitches need to be bred on the same day, we could split an ejaculate and breed each of them artificially. Or a lot of times if we have, 2 or 3 bitches, we'll alternate days and then allow natural breedings for each bitch on alternate days. Insemination types. So for fresh semen, there's of course natural breedings. And then we can do vaginal AI, transcervical insemination, or surgical insemination. For chilled semen, vaginal insemination, transcervical insemination, or surgical insemination are all possible choices. And with frozen semen, we really need to get that sperm into the uterus, so we only should be doing transcervical or surgical inseminations. And with an experienced veterinarian, TCI will provide you the highest pregnancy rates for all these types of semen, including natural breeding, because with TCI, we're getting the sperm into the uterus with less contamination. So there's less inflammation in that bitch's uterus as a result of the breeding. So for your stud dog contract, things that you want to include in your stud dog contract, you should require ovulation timing and brucellosis testing for all of your breedings. That's going to maximize your dog's pregnancy rates and give the bitch owner the best chance of obtaining a pregnancy. You should require health clearances based on the breed for all bitches that are being bred to your dog. And you should provide your health clearances to each bitch that is being bred to your male. You should state what you consider an acceptable or positive pregnancy outcome, and that might be 2 puppies or 3 puppies or 4 puppies, depending on the size of the bitch. But it's basically, if you don't get this many puppies, we're going to give you a breed back to the stud based on the stud fee that you paid. You should have a full explanation of what the breed back policy is, how many cycles you'll breed that bitch without having to pay another stud fee, what's going to happen in terms of shipping, ovulation timing, that sort of thing. If you don't require ovulation timing on the first breeding and she doesn't get pregnant, then you require it for the second one. And you should always provide an option for the bitch owner to be able to switch bitches if the bitch that they're breeding to initially proves to be subfertile or infertile, so that they don't lose that stud fee. I ask all stud dog owners, please do not require vaginal cultures in your stud dog contract. We cannot interpret vaginal cultures because there are supposed to be bacteria in the vagina, and these are the same bacteria that will cause the same normal bacteria or the bacteria that cause problems in the uterus. So bacteria in the vagina are completely normal, and we're not going to make any type of treatment decision based on a vaginal culture any more than we would make a treatment decision based on a culture of the dog's ejaculate, because again, sperm are normal there as well. Vaginal cultures are not going to prevent venereal diseases because the only 2 venereal diseases are brucellosis and herpes virus. And herpes is a virus, so it's not going to come up on a culture, and brucellosis requires a special media. So when you send in a regular aerobic culture, you're not going to pick up either of the venereally transmitted diseases. And all of the rest of the bacteria that the bitch might have in her uterus are normal bacteria, and the dog has the same bacteria in his prepuce. And so the last thing that we're just going to talk about is choosing a reproductive veterinarian. And so trying to decide whether you're going to go to a specialist or a general practitioner. For routine work, collections, just side-by-side collections and AIs, semen shipments. Either one should suffice for your needs. But if you're having an infertility with your male, better to go to a specialist than the majority of general practitioners. And granted, there are definitely general practitioners out there that have tons and tons of experience and are going to be able to do a good job. But the specialists are trained in dealing with infertilities and the best way to work them up and what the proper steps are. So generally speaking, going to a specialist for an infertility is going to get you down a clear path towards a diagnosis without a lot of delays, faster than most general practitioners. And if you are going to use a general practitioner, especially for things like transcervical insemination and frozen semen breedings, semen freezing, shipping semen, going to somebody that has a number of years of experience is going to be better than somebody that just, breeds 2 bitches a year with vaginal AI. Using the facilities that have lay staff that are not veterinarians, it's not recommended for anything beyond just routine collections and semen freezes. So they should not be making diagnoses. They shouldn't be making recommendations on treatment or supplements or therapies. They're not trained for that. And anything that they tell you, you should take to your veterinarian or to a specialist and see whether that's an appropriate treatment. So there's lots of lay facilities that do semen freezing and semen shipments, and that's, they do a good job. But beyond that, you should be seeking veterinary help. And specialists may cost a bit more to do things, but that is because they have extensive training and they're going to know how to deal with all the different types of situations in a more productive way. And often they have specialized equipment and training on how to use that equipment. So looking for your reproductive veterinarians, the specialty college is the American College of Theriogenologists, and the website is there for you. The Society for Theriogenology is for all veterinarians, not just specialists, but general practitioners as well. And also animal scientists are in the Society for Theriogenology. And the course web addresses are here. And then if you're looking for somebody overseas, Europe, Australia, South Africa, South America, they're going to be listed on the EVSAR website, the European Society for Small Animal Reproduction. And then in the United States, also going to most of the state board websites will have ways to search for specialists in your area. So in summary, when we're setting up, you're trying to set your dog up for a successful reproductive career. Remember to be proactive and start when your dog is young. Get some semen frozen before he's 2 to 4 years of age, just in case something happens. Utilize the science that we have. We're going to have better success rates, larger litters, and a more successful and longer reproductive life if we follow the science. Spend time developing your stud contract and make sure that it covers all of your bases and all of the different things that may happen. Take time to find a good reproductive veterinarian, even if they're a long distance away, because it's well worth it to have that person in your pocket. And then be honest and provide all the requested information to the bitch owner and their veterinarian so that they can do their best job to get bitches pregnant. The more information that you provide, the greater the likelihood that you're going to end up with a positive outcome. And then finally, I think that I'm not sure if the Testicle Festival still exists, but if it does, this is someplace that everybody should go sometime in their life. I haven't been yet, but I would love to go sometime.
Wow, I need to know more about that. That really, that billboard has made my week. I feel like a perfect note to end the presentation on. We do have a few questions. Thankfully, you answered most of them. So we just have a few remaining. The first one is, how does a small hobby breeder handle keeping the stud dog calm when stimulated by girls in heat?
So if we're talking about like outside the breeding situation, I think it's all about redirecting behaviors. So if your dog has has a favorite toy or is treat motivated, it's, moving him away from where the bitch and heat is and getting his attention directed to something that he finds that is just as interesting or fun as that bitch in season. And a lot of times it means, distancing yourself from that bitch and heat. Um, uh, to do that. But if you're talking about like an in-home situation, like you have, just one bitch and a dog, then I think that you either need to have, them separated by rooms, or if the bitch is in season, then the dog goes and gets boarded for 2 weeks, or he goes over to your friend's house or to your parents' house and stays there for the 2 weeks while the bitch is in heat.
Awesome. Okay. And then we have one more. This I feel like is a summary of this entire presentation, this question. What age is appropriate to start a stud dog, and when should they retire?
Well, so we've talked about when to start them. We shouldn't collect them before they're 1. And after that, you can start using them, assuming that your health clearances are all done and they've passed. They won't be to their maximal sperm numbers until they're about 3 to 4 years of age. And then, when to retire them really just depends on when their semen quality deteriorates enough that they can't be used. Because, older males, they may not be able to breed naturally, but we can still collect them as long as their semen quality is good. So some dogs may have a deterioration in semen quality when they're 5 or 6, and other dogs might be 14 or 15 and still have great semen. So when to retire just depends on your particular dog.
Got it. And then now we have another question relating to puppy food. So this person is wondering, do puppy foods with ingredients that contain phytoestrogens like peas, soy, or flax have any impact on the development of testes? This person is specifically interested in small breeds who may mature at a younger age than larger breeds.
Yeah, I think that it depends on whether you're talking about kibble, because in kibble, any phytoestrogens that are in the food are esterified by the heating process. So you don't really need to worry about those things in kibble. More of a concern for like our fresh foods. And there's this whole new world of fresh pet feeding, and we're seeing a lot more problems with that. Peas in general, I would say pea protein is something that we shouldn't be feeding our breeding animals at any time. So young or old, any type of pea protein in food should be avoided. But things like flax, which if you are feeding a raw oil, can have phytoestrogens. If it's in kibble, is usually fine and nothing to be worried about. So I think that it just, most of the time, kibbles are going to be relatively safe because of the heating process on any phytoestrogens other than like pea protein.
Awesome. And then we just have one question left. Someone is wondering where you recommend stud owners post their dog stud services.
Yeah. Now that's a good one. I mean, I think a lot of the breed websites, the club websites, have a place for breeders. So that's where to post. I think that like if you have a Facebook group for your breed, that is an appropriate place to post. People that are looking are gonna be on those Facebook groups. I would avoid, places like Craigslist.
Yeah,
You shouldn't post your stud dog on Craigslist or your litter of puppies on Craigslist for sale.
definitely not.
But I think like any social media that is linked to your breed club, or your breed are probably appropriate places to post for stud dogs. And I know like the AKC site has a breeder link area. So you can post there, and a lot of people will look there as well.
Awesome. I think that was the last question we have. So I just want to thank you, first of all, for such an amazing presentation. And I want to remind everyone again, now that we've gone through part 1, that there will be part 2. It's going to be on Wednesday, June 27th at 5 o'clock Eastern. And this is going to be managing a stellar stud dog, middle age through senior years. So our stud dog will have grown with us by Wednesday, June 27th. And that's what we're going to be covering then. So this was recorded as always, and it'll be shared with everyone tomorrow via email. It'll be also up on the Good Breeder Center, so you can rewatch it, especially in preparation for part 2 on the 27th. And we will be getting that Facebook event up tomorrow, so everyone can RSVP and make sure that they join us then, all that good stuff. But until then, thank you all so much for joining us for another one of these and asking such great questions and being such a great audience. And Dr. Lopate, thank you for hosting this presentation. This was amazing. I think I can speak on behalf of the community when I say everyone learned so much, and I'm sure they're all eagerly awaiting part 2 at the end of the month.
Thank you.
Awesome. All right. Bye, everyone. Have a great night. Thank you.
Bye.